use of opioids for either medical purposes or recreational reasons can sometimes develop into opioid dependence. Many people don't know that opioid dependence is a medical condition that affects millions of people like you, or that genetic factors and prolonged use of opioids may predispose a person to dependence.
That explains why I just can't stop. I mean, even though I want to, I really just feel so ashamed.
No, there's nothing to be ashamed of.
Many people don't know why they are unable to stop using opioids on their own. It's important to recognize that opioid dependence is a medical condition that can be treated with a comprehensive regimen that includes both medication and counseling.
Severe withdrawal symptoms and strong drug cravings can trigger continued use and make it virtually impossible to stop using opioids without medical intervention. In fact, opioid dependence is considered a brain disease because of the way opioid drugs change the functions of the brain.
Is there a way to treat this condition but keep it confidential?
Yes, there is. There's a medication called Suboxone that can be prescribed for you right here in the privacy of my office. Suboxone can be picked up at the pharmacy and taken at home like any other medication. Suboxone enables people to stop using other opioids and remain in treatment by suppressing their withdrawal symptoms and decreasing their cravings.
So how do I know if Suboxone is a good choice for me?
Suboxone's been effective in treating people with opioid dependence, and I believe it may be an appropriate option for you. We can begin treatment and see how you respond. Doug, I want to introduce you to my nurse, Kathleen. She'll review Suboxone therapy and answer any questions you may have. I'll see you later.
Hi, Doug.
Hi.
So, how you feeling today? So, do you have any concerns about starting treatment with Suboxone?
Yeah. I'm really scared of going into withdrawal.
That's understandable. Some patients even postpone seeking treatment because of the fear of withdrawal. As long as you are in mild to moderate withdrawal when you come in for your first visit, you should begin to feel relief about 30 to 60 minutes after you take the first dose of Suboxone.
If you have high levels of opioids in your system when you begin therapy, the Suboxone molecules may displace other opioid molecules in your system and lower the overall opioid effect too rapidly, potentially causing more severe withdrawal. To prevent this from happening, it's important that you are in mild to moderate withdrawal prior to your first dose.
But what if I still don't feel well after taking Suboxone?
That's a possibility because Suboxone impacts people differently. We'll adjust your dosage over time until you feel comfortable. It's very important for you to be open and honest with us during all of your office visits so that we can give you the best treatment possible.
But I don't like to talk about my drug use.
I understand, Doug. I want you to know that the information you share with me will only be used to help us create the best treatment plan for you and keep you on the path toward success.
Many patients feel embarrassed about their opioid use, but your doctor and healthcare professionals recognize that opioid dependence is a medical condition and will not judge you or your history of drug use.
Although it's not easy, you need to be completely open about your drug use and any family history of drug dependence or alcohol abuse in order to help us treat you appropriately.
Your healthcare professional understands that opioid dependence is not a moral failing, but a true medical condition that requires medical attention. You'll benefit from providing your medical team with all of the facts.
Is there any history of drug or alcohol use in your family that you can share? I'm also interested in hearing about your own personal history of drug or alcohol use.
Actually, I'm pretty sure my grandfather was an alcoholic. And I started abusing prescription painkillers about 2 years ago and recently used heroin. I've tried to stop 6 or 7 times, but I've always gone back to using because I couldn't stand the withdrawal.
Being candid about past attempts to stop using drugs and discussing techniques that were helpful for you can make it easier for your healthcare professionals to tailor treatment specifically to your needs. A strong support system is important to your treatment success and the process of recovery. Your doctor can also direct you to counseling support in your area.
Have you discussed your treatment with your family and friends?
Yes, I have. My wife and my brother have agreed to support me through this.
Well, great. Now we can truly determine the best course of treatment for you.
Can you tell me how Suboxone works?
Well, that's a great question. Let's take a look at Suboxone in action.
Opioids attach to mu-opioid receptors located in several parts of the brain. The mu-opioid receptors are located on the nerve synapses shown here. Opioids, which are represented as orange spheres, bind to the opioid mu receptors, shown here as red circles. As they attach, receptors begin to release dopamine, which is represented as the glowing yellow plus symbols. Dopamine release is responsible for producing pleasurable feelings or euphoria, referred to as a high. As opioids leave the receptors, the pleasurable feelings begin to fade. The black minus symbols represent the loss of opioid effects that result in withdrawal symptoms, which may begin at this time. Cravings may also start to occur at this time. As the opioid continues to leave the mu receptors, the patient may progress to a mild to moderate state of withdrawal. At this point, Suboxone therapy can begin. While the other opioid continues to leave the person's system, Suboxone attaches to the mu receptors and restarts opioid activity in the brain, producing less euphoria than full opioid agonists, but sufficient to suppress withdrawal and cravings. The buprenorphine in Suboxone bonds more strongly to the receptor than full opioid agonists, such as heroin, hydrocodone, methadone, morphine, and oxycodone at an equivalent dose. At adequate maintenance doses, buprenorphine fills most receptors and blocks others from attaching. Buprenorphine has a long duration of action, so its effects do not wear off quickly.
You should know that Suboxone produces limited pleasurable feelings compared to what you may have experienced from opioid painkillers that were prescribed for you. This should make it easier to focus on other aspects of your treatment and recovery process.
Can I take it wherever I am?
Yes, you can. After you're stabilized, I'll give you a prescription for Suboxone to fill at the pharmacy, just like any other prescription. We'll also set up regularly scheduled visits for you so that we can monitor how your treatment is progressing. In the meantime, counseling will help you focus on other aspects of your life.
To start treatment with Suboxone, you must be in a state of mild to moderate withdrawal so that the medication can take effect. If you are in this state of withdrawal, it is normal to feel a little uncomfortable. When you first start treatment, the goal is to find the appropriate dose of Suboxone needed to suppress your withdrawal symptoms and to reduce your cravings, so that you stay in treatment and don't feel the need to use other opioids.
Doug, I know you're not feeling great right now, but as we discussed, the reason that you're required to be in a mild to moderate state of withdrawal is to prevent Suboxone from worsening your withdrawal symptoms. During induction, the buprenorphine in Suboxone can displace the other opioids in your system. You need to be honest with us about the time of your last opioid use to diminish the likelihood of bringing about withdrawal symptoms. First, I'm going to examine you to assess your level of withdrawal and ask you a few questions. When did you last use an opioid?
Your doctor may use a standardized questionnaire to help decide if it is the right time to begin treatment.
Oh, okay. Based on your answers and your score on the scale, it looks like you're currently experiencing moderate withdrawal symptoms. Let's go ahead and administer the first dose of Suboxone, and within 30 to 60 minutes, you should begin to feel better.
Suboxone is a sublingual medication, which means that it's absorbed through the veins under your tongue. Before placing these tablets under your tongue, take a drink of water to moisten your mouth. This will help Suboxone dissolve more easily.
If your dose is 1 tablet, place it under your tongue on either side. If your dose is 2 tablets, place both of them under your tongue, one on the left side and one on the right.
When you're at home, you can use a mirror to ensure that the tablets are in the proper place. Tip your head slightly forward to help the tablet dissolve completely. And try to relax. Suboxone usually takes between 5 and 10 minutes to dissolve, but sometimes it can take longer.
If you have more than 2 tablets to take, place them under your tongue after the first 2 tablets have dissolved and follow the same directions.
When you take Suboxone at home, make sure your friends and family are aware that you shouldn't talk while the Suboxone is dissolving, because that can interfere with how it's absorbed. And Doug, be sure not to chew or swallow the tablets, because they won't work as well. When you become more comfortable taking Suboxone at home, you'll find you can do other things while the tablets are dissolving, like reading, watching TV, getting ready for work, or finishing up household chores.
Like other opioids, Suboxone can be dangerous and even fatal when mixed with other drugs, such as benzodiazepines, alcohol, sleeping pills, and other tranquilizers.
So, how you feeling now, Doug? Any discomfort?
I'm feeling a little better. Still a bit queasy and shaky.
Well, it's common to still have some symptoms after your first dose. Let's take a look at how you're doing, and then I can better determine if you need a second dose.
In many cases, your doctor will provide an additional dose of Suboxone in order to appropriately control your initial withdrawal symptoms. Be honest and complete when discussing any symptoms you feel, so that your doctor can adjust the amount of Suboxone you take in the future accordingly.
You feeling any better now?
Yeah, much better. But I still feel shaky.
That's not unusual. Some people feel better right away, while some of my patients take a day or two longer. The good news is that you'll know you're getting to the right dose as your symptoms decrease. Here's a prescription for another dose of Suboxone. Take it home with you just in case you feel significant discomfort later on today or tonight. When I see you tomorrow for your follow-up visit, we'll talk about your dose to make sure it's appropriate for you. My nurse will review the instructions on Suboxone with you, so you'll be comfortable taking it at home. You have any questions?
No.
See you soon.
It's important for your healthcare professional to evaluate how well Suboxone is working for you to ensure you're getting the right dose.
So, how you feeling today?
Actually, I've been feeling surprisingly well. Thanks.
And have you been feeling emotionally? Do you notice feeling anxious, irritated, or any other emotions?
I haven't felt irritated. Maybe a bit anxious, though.
Well, your anxiety is completely understandable. Some patients have dreams about drugs, while others have drug cravings triggered by their surroundings that may have been unknown to them before. You should let us know if you experience any drug cravings, because they can sometimes lead to relapse.
Okay.
If cravings do occur, you may need an adjustment in your Suboxone dosage.
So, how do you think I'm doing so far?
It looks like you're responding very well to treatment. But please, call me if you start to feel worse at any time. If that happens, we can look at adjusting your dose. Have you started attending counseling yet?
I haven't started yet. I thought that since I was already feeling better, I may not need it.
Doug, counseling is an important part of your treatment with Suboxone. It's great that you're feeling better physically, but it's equally important for you to participate in counseling as part of your treatment so that you can make progress in overcoming the psychological aspects of this disease and minimize your risk of relapse. We can even help you set up your first appointment. As we discussed, Doug, Suboxone is only part of a comprehensive treatment regimen. The other essential part is counseling.
Why isn't Suboxone enough?
While Suboxone addresses many of the physical symptoms of opioid dependence, counseling helps you identify other factors that may have contributed to your drug use. You'll also find your counselor helpful in providing tools you'll need for coping with environmental or emotional triggers that could prompt you to use drugs again.
But I've never been to counseling. When should I start? How often should I go?
I recommend you start immediately and go as often as necessary so that you can get the support you need and the results you want. Counseling is especially helpful in developing new skills to deal with triggers and cravings.
Ask your doctor for a referral to counseling. It is a critical part of your treatment plan. Your doctor should be able to connect you with appropriate counseling services in your area.
Can you recommend counseling services nearby?
Sure. I can provide you with a list of counselors who specialize in substance abuse in our area. These are professionals who understand your medical condition. I can't emphasize strongly enough the need for you to get into counseling.
So, how long should I expect to be taking Suboxone?
The length of treatment with Suboxone can be tailored to your particular needs. Simple answer, you can be on it as long as you need to be.
Then how will I know when I'm ready to stop taking Suboxone?
Once we're sure you're on a dose of Suboxone that effectively controls your cravings and suppresses your withdrawal symptoms, you'll transition into the maintenance phase. Now, I like to keep my patients in the maintenance phase until they've had a chance to address the underlying causes of their dependence through counseling. Once this has taken place, you, your counselor, and I will determine the appropriate next steps.
Are you saying that some patients stay on Suboxone for months? Even years?
That's right. But every patient's situation is different. Some patients require more time than others. When it's time for you to stop taking Suboxone, we'll slowly taper your dose down to maximize your chance of continued success. However, if you do feel that you're experiencing symptoms of medical withdrawal, tell us, and we'll address it right away.
It sounds like this is an ongoing process.
Yes, it is. And we'll continue to evaluate your needs as you progress through therapy and do everything we can to prevent the risk of relapse.
Plus, with the support of counseling, you can make the changes that will enable you to live a dependence-free life.
Yeah. I'm ready to work towards that. You know, I should really thank both of you for all your help.
Oh, you're welcome, Doug.
And you are doing great.
We'll see you at your next appointment. It's very important for you to know how to use Suboxone safely. You should know that it can be dangerous to mix Suboxone with other drugs such as benzodiazepines, alcohol, sleeping pills and other tranquilizers, certain antidepressants, or other opioid medications. Mixing these drugs can lead to drowsiness, sedation, unconsciousness, and even death, especially if injected. And please take Suboxone at the dose prescribed for you. Like other opioids, Suboxone has the potential for abuse and produces dependence of the opioid type with a milder withdrawal syndrome than full agonist opioids like hydrocodone, oxycodone, and heroin. Cytolytic hepatitis and hepatitis with jaundice have been observed in some cases. Call your doctor right away if you notice yellowing skin or eyes or dark urine. You should also know there are no adequate and well-controlled studies of Suboxone in pregnancy. Consult your doctor if you become pregnant while taking Suboxone. The most commonly reported adverse events related to taking Suboxone include headache, withdrawal syndrome, pain, nausea, insomnia, and sweating. Be sure to let your doctor know if you experience any symptoms like these. When taking Suboxone, be careful about operating machinery or driving a car. Please store Suboxone safely out of reach of children and destroy any unused medication appropriately. Following your prescribed directions will minimize your risk for adverse events with Suboxone. Please see full prescribing information for additional safety information.